recap you, I think it's important to do that, on what these new restrictions are here in the UK. Well, people will only be allowed to leave their homes for these following reasons. Shopping for basic necessities as infrequently as possible. One form of exercise a day. You can do it alone or with other members of your household, your direct household. You can leave your house for any medical need or to provide care for a vulnerable person, and you are allowed to travel to and from work, but this is only where this is absolutely necessary and it cannot be done from home. We were discussing the key worker descriptions with Vicky a little bit earlier. Let's talk to Professor John Ashton. He's a former Regional Director of Public Health. He's been formerly critical of the government's measures. What do you make of them thus far, Professor? Are they strong enough?
Well, we must all welcome these measures now and get behind them. We have lost 7 weeks. They should have taken place before now, and the epidemic is accelerating. But we must welcome the measures now and get behind them and make them stick. What we also now must do, though, is to protect the frontline health workers who are at risk. And the Director General of WHO said today that we cannot have an effective response unless the workers are protected. They need protective gear and they need regular testing themselves. And the testing regime has got to be put in place. So those two things are very important. The third thing is, though, that because of the numbers of cases that are going to come through, the number of deaths that we're going to see over the next couple of weeks, we really have got to mobilise the community, because the NHS will not be able to cope, and many people are going to have to be nursed at home and many people will die at home. And what we really need to do is to support the community groups that have risen up around the country to develop their nursing skills using online platforms like the Open University and so on, to support the development of basic nursing skills in the community, because a lot of this is going to have to be picked up at home, in towns and villages across the country, because there will not be the capacity in the NHS. And actually, because of the lack of protection of staff in the hospitals and the lack of testing, the hospitals now are in danger of becoming part of the epidemic. They're in danger of becoming contaminated. And we've really got to get on top of that and shift the focus as well, because constantly in this whole thing, we've been running to catch up, always a step behind. But as I say, we've got to get behind the Prime Minister on this. We've got to make this stick. And hopefully the public will accept that, although there's been a breakdown of trust with the public because of the mixed messages and the lack of transparency and the failure to put testing in place.
Professor, when it comes to the timing of this, you say that it's too late. When the government was explaining why they weren't coming in more strictly with the measures initially, is because they didn't want to see those spikes in cases. By doing it now, hasn't that sort of plateaued that spike graph that we've been seeing recently?
I think there's been a lot of misleading so-called science here. I mean, we've seen what's happened in other countries, not least in Italy recently. And we've seen also what works to keep this down. We've seen how successful South Korea has been, but we've been very reluctant to learn the lessons from elsewhere. And we've rather been obsessed with a narrow perspective coming from academics when we really needed to be more practical.
Professor Ashton, former Regional Director of Public Health, thank you so much for your expertise.